Kia ora koutou katoa. I'm Warwick Bagg, Dean of the Faculty of Medical and Health Sciences, and it's a real pleasure to welcome you, our future students, your whānau, and the schools and communities supporting you. Our health matters to every one of us. It shapes our lives, our families, and our communities. And right now, here in Aotearoa, New Zealand, and around the world, health systems are facing some of the most complex challenges they've ever seen. We need people who are curious, compassionate, and ready to think differently about how healthcare works. People who want to make a difference, whether that's through patient care, science innovation, data, policy, or working directly with communities. At the Faculty of Medical and Health Sciences, our responsibility is not just to teach you what has worked in the past, it's to prepare students for the future. From 2027, we're introducing a new degree, refreshed programs, and clearer pathways, offering students more choice, more flexibility, and more ways to build a meaningful career in a health-related discipline. These changes reflect how health careers are evolving and how students want to learn today. Learning that is connected to the real world, inclusive, future-focused, and full of possibility. Whether you already have a clear career goal or you're still exploring what excites you most about health, these changes are designed to support you, helping you build strong foundations, to develop modern skills, and to find a pathway that fits who you are and how you want to make an impact. In this webinar, you'll hear about what's on offer, why it matters, and the different ways you can study with us from 2027. I hope as you watch, you'll start to imagine the role you could play in shaping the future of health for our communities and for generations to come.
Health and how we study it is changing. From 2027, health education at the university has been redesigned to reflect the world students are entering, a world where health challenges are complex, careers are varied, and there's more than one way to make a difference. So what's actually changing, and what does this mean for you? From 2027, students will have more choice in how they begin their journey into health study. You can choose from diverse undergraduate programs designed to support different interests and strengths, including a new Bachelor of Biomedical Science, a refreshed Bachelor of Health Sciences, which now features 2 new majors, updated health majors within the Bachelor of Science, and our established Bachelor of Nursing program. This means you don't have to lock yourself into one path before you've had time to explore what inspires and motivates you. Across our health sciences and science degrees, students can choose from 8 specialized health majors. Some majors focus on working directly with people and communities. Others focus on data, systems, science, or how treatments are developed. Whether you're interested in community well-being, biotech and genomics, nutrition, pharmacology, or the science of how the body works, there's now a clearer way to shape your degree around what excites you. From 2027, pathways into clinical health careers like medicine, pharmacy, optometry, and medical imaging will be clearer. There will be more Year 1 routes into these Year 2 clinical programs, streamlined selection processes, and updated entry standards. In short, there are now more ways to get there and simplified entry pathways. A career in health doesn't begin and end with a clinical role. Our new study options also create strong pathways into non-clinical health careers, postgraduate study, research, industry, policy, and innovation, areas where demand is growing rapidly. This means if your interests evolve, your degree can evolve with you. Put simply, these changes are about choice, clarity, and confidence. You can explore before specializing, keep your options open, and build skills that are future-focused and in demand. From 2027, there will be clear pathways to help you find the health career that's right for you.
Biomedical science is not just a new degree, it's a new way to study health, designed for the future of medicine and research. Some students know early on that they're fascinated by how the human body works. Others are driven by curiosity, wanting to understand disease, discover new treatments, or shape the future of healthcare through science and innovation. If that sounds like you, the Bachelor of Biomedical Science could be the ideal place to begin your health journey. The Bachelor of Biomedical Science is a brand new, future-focused degree. It's designed to reflect how health and medicine are evolving. It brings together science, data, and clinical insight to help students understand not just what happens when the body is unwell, but why and how that knowledge leads to real-world solutions. This program explores human health and disease from the molecular and cellular levels through to whole body systems, and shows how scientific discoveries translate into diagnostics, medicines, and new biomedical technologies. What makes this degree different is its integrated, modern approach. Rather than specialising too early, students build a strong, connected foundation across the core areas that underpin health, including biology, genetics, immunity, physiology, and data-informed analysis. Learning is case-based and disease-focused, helping you see how science connects directly to patient outcomes and health breakthroughs. Biomedical science is also a cohort-based degree, meaning you move through the program alongside the same group of students. This creates a strong sense of belonging, shared purpose and support, something many students will value deeply in a challenging and rewarding field. Importantly, this degree keeps multiple pathways open. For students interested in clinical careers, Biomedical Science provides a clear Year 1 pathway into the Year 2 clinical programs, such as medicine, pharmacy, optometry, and medical imaging. At the same time, it prepares graduates for a wide range of careers beyond clinical practice, including biomedical research, biotechnology, pharmaceuticals, diagnostics, health technology, science communication, and further postgraduate study. If you're motivated by curiosity and want to improve health outcomes, whether it's at the bedside, in the lab, or through innovation, Biomedical Science offers a powerful, future-ready start.
I chose to study biomedical science because of a deep curiosity about how the body works. I've loved the practical aspect of my study, the labs, exposure to cutting-edge research, and opportunities to explore how the body functions have made learning engaging and meaningful. It's shown me how complex health conditions can be, reinforcing the importance of research, evidence-based practice, and clear communication in healthcare. I now see health not just as a treatment, but as a combination of biological processes, patient experience, and support systems working together to achieve better outcomes.
Some of the biggest challenges in health today aren't solved in hospitals alone. They're shaped by the communities we live in, the systems we build, the policies we design, and the choices available to people every day. If you're passionate about improving well-being, addressing health inequities, or strengthening how health systems work, the Bachelor of Health Sciences could be a great place to begin. The Bachelor of Health Sciences is a future-focused degree designed to reflect the real-world drivers of health, from prevention and population well-being to policy, data, and systems design. What makes health sciences distinctive is its people-centred perspective. You explore not only what affects health, but why, including social, cultural, environmental, political and economic influences on well-being in Aotearoa and globally. A key strength of the degree is choice and flexibility. You can tailor your studies through 2 specialised health majors, allowing you to shape your degree around your interests and future goals. Community health is ideal for those who want to work with people and communities in areas such as health promotion, advocacy, prevention, and improving equity for groups that are often underserved. Health systems and data analytics focuses on the engine room of health. It's for people who enjoy problem solving, data and systems thinking, and who want to influence how health services are designed, delivered, and improved. Health sciences also keeps multiple pathways open. It provides a clear Year 1 pathway into clinical programs such as medicine, pharmacy, optometry, and medical imaging, while also supporting a wide range of non-clinical health careers. You can choose a single major, take a double major, or combine health sciences with a nutrition major, depending on how you want to shape your future. If you're motivated by impact, fairness, and the desire to improve health outcomes at a systems or community level, the Bachelor of Health Sciences offers a flexible and meaningful pathway into the future of health.
One of the biggest things I enjoy about studying health sciences is the range of topics you get to learn. You cover everything from epidemiology and data analysis to mental health and health policy, which gives you a much broader view of health. It's a unique degree because it gives you the tools to understand why some populations struggle more than others and how we can move from simply providing treatment to empowering communities to take charge of their own well-being. It's incredibly worthwhile because you learn how to advocate for your own community, whānau, and others in a way that creates real systemic change.
Many health careers are built on science, but they don't all look the same. Some focus on how medicines are developed. Others explore how nutrition, movement, or body systems affect health. Some contribute to patient care behind the scenes through research, diagnostics, innovation, and technology. If you're interested in a health career and enjoy science, the Bachelor of Science with a health major offers a flexible, future-focused pathway. The Bachelor of Science includes a refreshed suite of 6 health-focused majors. These majors allow students to study health through a scientific lens while building skills that are highly valued across clinical, research, and health-related industries. You can choose to focus on how the body functions, how diseases develop, how medicines work, how nutrition supports health, or how exercise and movement contribute to recovery and well-being. What makes this pathway particularly powerful is its flexibility. You can choose to take a single health major, combine health with another science discipline, or complete a double major, giving you the ability to tailor your degree and adapt as your interests develop. Importantly, these health majors also provide a clear Year 1 pathway into clinical programs, including medicine, pharmacy, optometry, and medical imaging, while also supporting strong non-clinical health careers in areas such as medical research, pharmaceuticals, diagnostics, health technology, policy, and postgraduate study. This means you don't need to choose between science and health or commit to one path too early. You can build a strong foundation, explore your interests, and make informed decisions about where you want to specialise. If you're motivated by health, grounded in science, and want a degree that offers career flexibility and long-term relevance, the Bachelor of Science with a health major is designed to keep your options open.
You've heard about different ways to study health through biomedical science, health sciences, nursing, and health-focused pathways in the Bachelor of Science. You might already have a clear goal in mind, or you might still be exploring what excites you most about health. Health careers today are incredibly diverse. Some are clinical and patient-facing, others focus on science, research, data, systems, innovation, or working directly with communities. Many students move between these areas over time. What's important is that from 2027, health study is designed to give you options. You can choose a pathway that builds strong foundations, keeps future opportunities open, and allows you to specialize once you've had time to explore where your strengths and interests really lie. Some students will move toward clinical practice. Others will shape the future of health through science, policy, technology, research, or community leadership. And many will do a combination of these over their careers. Health careers don't follow a single path. With more choice, clearer pathways, and future-focused learning, you can find what's right for you. We want you to hear directly from some of our students in their own words about why they chose to study health.
For me, I've learned that it's all about human connection and compassion and really meeting people where they are. I really want to use my knowledge to support and uplift my family as well as the wider community and to provide a care that truly reflects the community it serves.
I chose to study health because I really care about helping people, and I care about the way that the body works. I really hope to make a meaningful impact in the future. I really want to make a difference in people's lives.
I chose to study health because I love learning and I wanted a career where I'd always keep learning. Health and medical fields are constantly growing and changing, and I want to be part of that, especially to help improve health equity for our Māori and Pacific people. Knowledge is mana motu hake.
This degree has changed the way that I think about health by allowing me to really understand the very important difference between equality and equity and how this has such a huge impact on the health outcomes that we currently see in our population today.
I've changed the way that I think about health. It's not just about treating people, it's about the systems, the policies and structures that shape outcomes for communities and for the whole of New Zealand. I want to take what I've learned and use it to make a real impact on people's lives.
Ko Matire Hau tōku ingoa. I'm the Deputy Dean in the Faculty of Medical and Health Sciences. Listening to our students, you can hear something really powerful, not just about what they're studying, but why they chose health. A desire to help others, a commitment to fairness and equity, a hope to make a difference in ways that matter to people and communities. That's why we're so excited about the changes coming for 2027. They're not just about new programs or new pathways. They're about creating a system that recognises different strengths, different starting points, and different ways of making an impact. We know that not everyone arrives at university with the same experiences or the same opportunities. And we know that not everyone's journey into a career in health looks the same. These changes are about making sure more students like yourself can see themselves in health, whether your interests lie in clinical care, science, data, systems, research, or working directly with people. Wherever you're coming from and however you're still figuring things out, there is space for you here. We're committed to supporting you, to helping you explore your interests, to build confidence and find a pathway that fits who you are and how you want to contribute. Your future in health starts here.